Uh, Today we have Professor Ofer with us. He is a very senior shoulder surgeon. He is one of the pioneers in shoulder arthroscopy and is also inventor of many of the shoulder arthroscopy instruments like system. He is also the president of Israel Shoulder and Elbows Society, and we are here with him to learn more about the nuances, the new things that are come up in shoulder arthroscopy, and how his innovative techniques have reshaped the future of shoulder arthroscopy. So, sir, can you tell me about what is this pitch patch and how does it change the results of the rotator cuffs that you do?
Well, the pitch patch is a synthetic patch, which is woven in a certain way that it's remain friendly for cells to grow over. I've been using it for the last 12 years. It's from 2013 when it's just appeared. I used the predecessor, which is exactly the same, but it was called lead scuff, but I used it for many years. And we actually looked at our study a few years ago on the first 30 cases that we've done, and the results were very, very encouraging, actually amazing. What we saw that it actually makes a very nice tissue, the growth of the tissue. It's ingrown into the patch, on both sides of the patch. We did ultrasound scans on all patients, and you can see on the ultrasound how thick is the tissue that actually there was no tissue there before. I'm using it in cases where the rotator cuff quality is very poor, the tissue is poor, to augment the tissue. I use it in cases where I can't do a good repair, or I do repair which is in very much tension and you have a little bit of gap or something, so I augment it with a patch. And in a way, I'm not allowed to say bridging, but it's actually bridging the area that I can't really repair. It reduces the tension from the repair, and these are the cases that actually it works really, really well. As I showed yesterday in the presentation, the results are amazing. We had 3 cases that we had to revise to a reverse shoulder because of failure, but there was no failure of the patch itself. The patch was solid, intact, and actually good tissue. What failed was the engine, the muscle didn't work anymore. That's why the patient were not actually up to what they wanted to achieve.
So this is a synthetic patch. So
Yeah.
is there any biological healing also?
There is, definitely.
Which is
well, I use it with PRP. I inject PRP. The idea is that to add some biology or to enhance the biology of this patch. The patch is hydrophilic, which is very nice for the PRP because it's absorbed the PRP straight away. And I believe the PRP helps, but again, you can do it without PRP as well. As we did today, you did an acromoplasty and the PRP, a shower fell down on that and sat down. Yeah.
So realistically, we can say that we can reduce the re-tear rates, and
yes,
we can improve the results by using the pitch patch.
You can reduce the rate of the re-tear in these cases that are prone to have re-tear. They are not good tissue. You definitely improve the tissue. What we saw in the cases that we had to revise, that the tissue was so good that we can use a good tissue when we did a reverse shoulder. That was nothing there before. Yeah.
So many of our orthopedic colleagues, orthopedic young surgeons will be watching this podcast. So what will be your message to the young surgeons who are starting arthroscopic rotator cuff repairs, and what are the good cases for them in which they should start using pitch patch?
Well, the cases, again, I would say it is for surgeons that are a bit more advanced in arthroscopy. It's not for the beginners, but it's cases where they feel that the tissue is very thin or fragile and not really good tissue, with a lot of frays and all this stuff. Cases where they have to put a lot of effort after release and all that. to bring the tendon back, and sometimes need to do some medialization in order to have some contact with the tuberosity. In these cases, the pitch patch will help them a lot. Cases where they can't really do a full repair and we do a margin convergence, restore some force couple and then help it or reduce the tension with a pitch patch and cover the whole area with a pitch patch. Actually, a pitch patch serves as a scaffold for new tissue growth and have a good tissue cover after that.
So sir, how many sizes are available in pitch patch, and how would you decide which size of the pitch patch we have to use for the particular case?
There are two sizes, I think. There's a standard one and a large one. The idea is that you have to use the one that will cover the area that you want to cover. So you'll be able to get it from the muscular tendon junction to the lateral side of the greater tuberosity. So you have to cover the whole area. It depends on the size of the patient, and it depends on the quality or the size of the remaining tear or the poor tissue that you want to cover. And you know the sizes of the patch. You can measure with some marked instrument the size inside. You can assess it. I mean, once you become more experienced, you can assess it just by looking at endoscopy. But you can measure with a probe that is marked the size inside, and you take the size that fits best this particular patient.
Thank you, sir.